This is the Redux News. A new virus that originated in Wuhan, China prompts the U.S. to screen passengers. U.S. health officials said Friday that all passengers from a Chinese city at the center of an outbreak of a new and deadly respiratory virus will be screened upon arrival at 3 airports in the U.S., starting with New York's JFK Airport late Friday night. The only other U.S. airport with direct flights from Wuhan, China is San Francisco International Airport, which has the next flight scheduled to arrive on Saturday morning. The third airport, Los Angeles LAX, handles connecting flights from Wuhan, and U.S. officials said they'll be looking for any ill passengers on those flights. The Centers for Disease Control and Prevention said it had dispatched officials to those airports just before the peak China-to-U.S. travel season, with an estimated 5,000 people expected to travel from Wuhan, China to the United States for the Chinese Lunar New Year on January 25th. The CDC has conducted airport screenings only one other time, in 2014, in response to concerns over the Ebola virus. Officials in China are racing to contain the outbreak of a new virus that has left at least 9 people dead and sickened more than 440, after it was confirmed that the infection can be passed between humans. Others fear that authorities have not moved quickly enough to contain the spread of the virus or educate the public. In Wuhan, temperature checkpoints have been installed at the airport and at train stations and bus terminals since January 14th, about 5 weeks after the virus was first detected. The spread of the respiratory virus to Thailand, Japan, South Korea, Taiwan, and now the United States is fueling fears of a broader epidemic as China enters its busiest travel period of the year. In Wuhan, the central Chinese city where the coronavirus was first detected announced a series of new measures on Tuesday, including the cancellation of upcoming Lunar New Year celebrations, which had been expected to attract hundreds of thousands of people. Authorities have still not identified the source of the infection, which further complicates the government's ability to contain the outbreak. Quote, "At the moment, it is a bad flu. Yes, it is something to be concerned about, and it is probably going to get worse in terms of infections and mortality. But again, it's winter. It is likely to spread, but we are still a long way off the levels of SARS or a bird flu." End quote, said Nicholas Thomas, associate professor focusing on health security at City University of Hong Kong. Authorities have advised residents in the run-up to the Lunar New Year, which falls on January 25th, to be on the lookout for symptoms, including fever, coughs, breathing difficulties, and pneumonia. Millions of people will crisscross the country during a week-long public holiday starting on January 24th, in what is known as humanity's largest migration. The WHO has not recommended any travel restrictions, and Chinese authorities have not yet issued any. Still, not all residents were comforted.